My name is Dr. KEHPHPU. I am a public health officer, but right now retired. I have worked for the Ministry of Health at several levels. I started from, unfortunately I didn't go to the division level, but I started from the district. I've worked in many places. I've worked in Rift Valley, I've worked in Coast, worked in Nyanza, and I've worked at the central level. Other than that working, I think I'm also happy that God has given me the grace to grow within the profession. And I don't take that very for granted, because I consider that my movement to the top, although not assisted by merit, was something which came out of the grace of the Lord, and sheer hard working and believing in public health. So, other than public health, I've also sat at the UN level as a board member representing East and South Africa for quite a long time. I've also, within the country, I've represented the Ministry of Health as alternate to the PS in several boards where the Ministry of Health has got interest and its opinion is required. I've also been in many social aspects, and it might also interest you that there are those recognition you are given by other entities. I am been awarded the fellow for the Institute of Africa in matters public health, and I think there are very few people in this country who have been given that. The other guy, I think, is this guy who is in syndemic diseases. And in terms of output, working for the country as a civil servant, I am grateful that my work and output has been recognized by 2 presidents. The very first one was the Order of Growing Warrior, that is OGW, by the President Kibaki. And then the other one was out of the hard work that myself and many people, including our current Director General, Dr. Moth, our Minister, Senator Mutai, and many other, including the Massimo Ngangi, and the many people, we worked tirelessly to safeguard the interests of public health and trying to control the COVID effects. President, His Excellency President Uhuru Muigai Kenyatta honored me with the Elder of Burning Spear. In fact, in that celebration of that day, I was only number 2 to the head of the army, so in that order. So I'm very grateful that during my tenure of work, I have offered my all to the profession and beyond. I have got no regrets to make. If I made very hard decisions, that is what was expected for me to do. If I made any decision professionally, which I guarded selfishly not to, then if anybody can actually raise it, then I would be able to have my regrets. But as far as I'm concerned, I did what was expected of me during my period. And obviously, when you are a strong leader, a leader who cannot be swayed, there are also other busybodies who will be tending to want you to do the things the kienyeji way. So for those ones, still, I don't have any regret. Thank you very much. That is me. And I talk what I think is right. As you might be aware, public health is an interesting field. In that every time it keeps evolving and it keeps changing, and the dynamics, every minute has got different dynamics. If for an event, all those who are involved in matters enhancing the public health interest of people in any given point or country or area changed the dynamics are that the initial dynamics, there will still come another evolving dynamic which will be emerging out of that. So public health interest will be here in donkey years to come. Even if we went into very serious developed countries, some where maybe some of us have studied, like in Japan, what we could be struggling in terms of public health in trying to manipulate the environment to have factors eliminated from causing the ill health in people, you will find that in those places which are highly developed, the factors will be different, but they are still public health interests of those people. So, but you must continuously assess what is likely to affect people in any given place at any given time, and ensure that you must work against those factors for you to give an enabling environment for the people or the population to live in a more healthier way. So like in our country, we have taken quite a number of years from independence. And you are aware that a country like ours, initially, our public health interests were around communicable diseases or communicable area. But as we continuously, or as the country continuously improved, then we had dynamics changing. Now, the non-communicable diseases were coming in. Now, and the non-communicable disease, you must go retrospective to be able to check what are these factors that are actually affecting the norms of a human being to heal health. And those are the ones now the public health providers are supposed to be targeting. But we can also not forget that even when we're having the changing and new emerging issues, there are some basics that we can never imagine or pretend that they are not there. For example, there are issues that are around food, there are issues that are around water, there are issues around pollution, and all these, even accidents. We must be able to understand why, for example, are we having a number of accidents happening and what needs to be done. That is purely public health. And but unfortunately, In terms of policy and policy statements, we talk about ni heri kuzuia kuliko kutibu. But in the actual happening, that is not what we are doing. We are actually spending more money in matters that we should have been able to forestall. Long-term planning and putting factors in place which are supposed to eliminate the factors which are actually likely to affect the people. For example, even if we went to the roads, for example, we must understand, we must actually address ourselves into issues. Why are we having so many accidents? Is it the road? Is it the human? Is it the vehicle? Or is it the passengers? Because everybody must be having an issue that we must address. And once we address that one, and if systems are going to work, because if you give a public health solution, you are not most likely to be the one who is supposed to implement that solution. There are also other actors. So public health is a multi-sectoral approach issue, so that when you give a solution, the solution is supposed to be picked, the solution is supposed to be implemented, and maybe followed to see whether it is actually making sense. And if it's not making sense, because in the planning, if there could have been an issue that didn't work well, then there is always room for you to replan and actually give the right solution. So to me, if I went into the basics in this country, I think the biggest problem I am seeing, and maybe which will be a time bomb, is that we must, because when we came out of independence, I think the people were following rules. And I am not being theoretical. These are realities. Some people will be saying, let us allow our people hawk food, for example, everywhere. These days you see guys who have got no idea about safety, in terms of food safety. They are carrying a number of thermos flasks and mandasio or whatever it is, and they don't care. They are just giving it, and nobody. I don't know. I don't see anybody getting worried about that. From where I'm seated, I'm extremely worried. One time when I was seated in the petrol station, I saw one of those guys. They came with the nyanyas and they are just cutting them there at the petrol station outside in the open. And the next person, if I am a partaker, I'll be taking that one, not knowing what is happening. So I'm worried. Issues of helmets, minyo, we are likely to have it going up. Issues of contamination from heavy metals, we are likely to have that one up. Issues of diarrhea, we are likely to have, if we are not having it, we are likely to have it. But I think I will only challenge those who are following records to check, are we on a downward trend in terms of these diseases, or we are going up? Maybe we are not following, and maybe we are not connecting where we are getting this. In terms of the bigger emerging issues, and aware that the Minister of Health had embraced the need to have further education in all those who are in public health, including public health officers. We should be able now to strengthen the providers of public health to have further training in specialized areas, so that some of them would be in policy, some of them would be at the action point. And I am also afraid that as a Kenyan, when I read the papers, I don't see counties, because now they're the ones who are employing. I don't see them employing more cadres who are actually aligned to public health profession, public health officers and other colleagues who are on those. I don't see that. Essentially, what it means is that the staff ratio to the work at hand might be minimized to the point that you might not have the people. And another thing that I think people should be worried is people masquerading to have been qualified in this. So we see and we hear, and maybe when I left through the council, we got so many people who were actually employed in the name of public health officers, and yet they didn't have the qualification. I think that we should worry, because you cannot have a person who is actually pretending to be a provider when he doesn't have. Then it means he would be robbing somewhere to try and give a service that he or she doesn't understand. I think the need for more public health officers, public health technicians, nutritionists, community health workers is now, and it will never go down, because if and the beauty is that when I was in the ministry, I interacted and I was a member of so many committees and which were working on issues that were futuristic. I am aware that even in the thinking of SHA, where we are having the issues of community, strengthening the community, you could be having that one as a policy, because if the law extends to policy and then you don't answer the requirements. So the need for these cadres would be there as long as people live, as long as we develop, because development comes with other effects on public health. So if I were to advise, is that the rational and the singular thinking that you must strengthen the public health providers by having the numbers and the specialties for you to be able to control the effects or the factors that are supposed to be causing disease. The effect of that is that the cost of treatment, the cost of hospitalization will automatically come down. I think those are the economics that colleagues who are making policy in matters of health and deployment of human resource, plus even equipment, must be reminded every day. I think the key of crisis management is the overriding leadership. The key. Try not to over leadership, then that you can never manage a crisis. So in every planning, the leader must be very clear on what he or she wants to do, or in terms of providing that leadership. For that leader to be able to do that, the leader must be solid in terms of must be knowledgeable. You know, if you don't understand what the subject you are offering leadership, you can never offer leadership. So you must be all around an informed person. But should you fail in some areas, because I am also aware that you might not know everything, then embracing teamwork is very critical. But even as you are embracing the teamwork, you must be at least have an idea on where and what do you want as a result. And for you to do that, you must also be a very firm person, because offering leadership is not something that you go and actually take easy ways. So you must be able to be firm, must be informed, must allow for officers or people who are working with you to provide what they also have, because I believe they are also having something to contribute. So the sum total of the ideas that are coming from all those who are actually given this subject and you offering the leadership is what should be able to manage a crisis. And the crisis, you should be able to describe it clearly, and you must have your steps on how you are going to handle the crisis. And you must know at what point in time the crisis is now being seen as being managed. Mm-hmm. So those are critical areas. Mm-hmm. Yes.
Thank you so much. And perhaps how can research and policy better align in public health?
Oh, that is a serious tool in public health, because as I said even in the beginning, lack of research or lack of using or utilizing research findings, you are likely to be offering solutions which are based on non-tangible issues. So research is so critical that it will actually pinpoint where the gaps are. And the research should be able to also inform you, if you are going into research, it will inform you also what has been done in the area and what gaps and what contributions other people have made. From that, gathering that information, when you are planning for any solution, then you will be all sound that the solution you are making or you are giving is based on some facts. That's a good question. And I also want to thank the government of Kenya. Way back when we had the two ministries split into two, when we had the ministers, Professor Nyong'o and Senator Beth Mugo, I had the benefit of co-chairing the midwifing of the Health Act. My other co-chair was Dr. Buanya, Judith. In the wider findings and the formulation of the Act, many things were envisaged, and I'm happy that some of them are now being implemented. But there were also areas that that Act required some formulation of new laws or new acts. And one of them actually is now, from when the Act took place, thereafter we were supposed to have new acts. Why new acts? To further redefine the areas that were actually touched in the Act. And one or two, let me just mention two. One of them was the Environmental Act, which was supposed to have been in place, and another area where an act was supposed to have come out was on issues of family health, which I can remember. But one is requested to visit the act because it's available and they look at it. And I'm only trying to give you background and historical issues so that now I can give you what answer your question. And we also want to thank some working partners, the World Bank office in Nairobi and UNICEF for having supported the thinking of having an environmental health and sanitation act. I am aware that this act was taken through the required levels of within the Kenya Act formulation or bill and act, the bill first and act. Stakeholders were called to be able to give their contribution, and we had some very refined lawyers who were also working with us, including the ones in the ministry, and also we had consultants. So, as far as I'm concerned, the act, from the very basics, the act was there and available. Meaning, one of the questions that were raised in the Health Act was being answered by getting this act ready. As to why there is some dancing around the act, one wonders. Maybe one thing I would raise is that even in Parliament is gauged or rated highly by the number of bills they are passing and acts they are passing. I would also think the same should apply to entities like ministries and departments. They should be rated by how many bills and acts they are churning out of interest and service delivery. I believe the passing on and approval of Environmental Health, Hygiene and Sanitation Act is long overdue. The document is available. I am aware that there is provision for those new ideas, if there are new ideas that needs to be cooperated. Those who could not be, who feel maybe not happy, the best way to do with an act is to give your side of the story and have things happening, because acts and bills are developed for posterity. They are not individual, because they are not supposed to be answering interests, selfish interests of anybody or an entity. They are supposed to be answering the common good of society. So my call is that this act was bringing in a very rich information on how we could manage, we can manage issues in environmental health and hygiene and sanitation going forward. So the earliest it passed, the better, and the applause for anybody, those who are in the Ministry of Health, those who are in other sectors, because laws are not, essentially, it is the Ministry of Health which will be honored as having produced. But this act, having passed, is not going to be the business of health alone. It can be used by anybody, individual, entities, because it becomes a property of government. Community health is, let me start with the community. Community health is the bigger umbrella. We are talking about the good health of the people in totality. And this, majorly, if you address the prevention issues, you are most likely to minimize any outcome, any disease outcomes. But should there be disease outcomes, then now the other levels of treatment will come in at the community level. And this is the bigger focus that the country has been having for quite a long time to strengthen the component of community health, which gets support from issues of issues on public health. But because when we talk broadly about public health, then one will even now go into issues of issues beyond the prevention. But if we do very well in community health, there will be tremendous reduction of treatable diseases, or diseases that are likely degenerate into the diseases of long term. First, I think, again, I want to repeat that I am extremely impressed that, sometimes people would be remembered, or are supposed to be remembered by what theoretically they were thinking and maybe started doing. But when you see it growing, for example, let us talk about even this house where we are seated. The person who was thinking about building this house was just only having an idea, and he thought there would be need for such a house. But now, maybe the person is not there, but we are now the ones who are using this. So I'm giving this analogy just to reflect to the union. During my tenure at the ministry, there are quite a number of things that I wanted done, or I wished done. Key in terms of system was the regulating the profession. Working, and I want the current Minister for Health, I think, was so critical in assisting us as a ministry, then as a majority leader, to have this one passed. And I want to appreciate I spent some time in his office, and he did assist us. So that was done. The Honorable Duale, as a majority leader then. So, I thought we were there because now we could regulate, because we had quite a number of quacks who were working around, and sometimes back there were quacks in all professions, doctors, public health officers, nurses. So, but two of our colleague cadres had their own union. So I thought I should put a union in place, working with other people, as I've said. And the Parliament Health Committee, then we had the council in place. That was a tick. And I'm happy that is part of the systems that are in place that should be able to be used to be able to streamline the profession. But in between, I realized that the staff required a voice outside, a voice which is within the law. And the only voice which would have been within the law is a council, a union. For quite a long time, we didn't have a union. We operated under an association. And an association has got its own limitations. So I sat down and I wondered if this is what is supposed to answer our problem. And I am the one who is at the highest point in time, then it is my duty and responsibility to be able to deliver this. I called a few people. We sat in my office then, I think that time I'd moved from 4th floor, and now I was actually a director in charge of special programs in this country. One among the 6 directorates that were in the ministry that time. But still I said, I am the one who is at the highest point in the profession. I must deliver. Down the line, I think we are happy that we delivered, and we had the interim, the guys now who are actually running Ogendo and Shira, who I think having managed to put such a conference in place is a positive outcome, because you are providing room for interaction with the professionals within and beyond, and also even guys who are not within the profession to be able to ask. Now, I come to your question. This is, as a system of individuals or professionals, the call upon all individual professions is that you must be seen to add value in the profession. You must not be a joyrider. You must come in with something that you can be able to hold and say, I assisted in contributing this in the lifetime of the profession. You cannot to be a person who is always ready only to look at things negatively. So you cannot be only waiting for people to do things for you to be able to find mistakes. Let us also have what you can provide so that we discuss about it. Good progressive development is all about adding value, not being a big noise maker when you cannot even bring anything on the table. That is my view. So colleagues who are outside, who are actually the colleagues who are actively serving this country, you have a job at your hands to be able to deliver. Those of us who are outside there, who have retired, it doesn't necessarily mean that we don't have a job to do. We are also doing it. We are doing it differently now. We are not. We are no longer civil servants. But we have a role to play. You who are in the civil service, you are people who are supposed to provide service to Kenyans, because the ones who are giving you salary. Kenyans like me now, who are outside there, who are informed, we expect more. And for you for us to expect more and to see something development, let us see professionals, public health professionals, articulating issues and providing solutions. If you don't provide solutions and leave a gap, somebody else would have to come and masquerade to be giving those solutions on your behalf. So, if you have got to seriously safeguard the job, be at the front line by providing what is expected on you. And thank you very much.